live? Is it live? Good morning. Thank you so much for joining us today and for bearing with us while our breakfast caterer was a little bit delayed. I hope everyone's gotten breakfast and at least a cup of coffee and has found their way to their ID badges and bags. We're so grateful that you're here with us today. And it is my pleasure, before we start, to introduce to you Dr. Sue Furth, who's the Chief Scientific Officer of our institution, to welcome you to CHOP, because we benefit a lot from the support of CHOP, not least of which this facility, which literally opened last week. And thank you very much, Dr. Furth.
Well, good morning. I don't want to hold up your day, but I wanted to welcome all of you to Philadelphia and the Children's Hospital of Philadelphia. As Adeline mentioned, I am the Chief Scientific Officer here at CHOP, and our goal in the Research Institute here at CHOP is to really transform the future of pediatric medicine. We have 4 major initiatives: 1, to invest in leading-edge technologies; 2, to advance the clinical research, research into the clinical arena; 3, to strengthen our partnerships; and 4, to secure our core as an academic medical research community totally dedicated to child health. I was so pleased to be invited to speak just a few minutes today to the Global Leukodystrophy Initiative, because it's very clear that we share goals of accelerating that research to clinical integration and strengthening partnerships. We all know that we can't bring idea to patient implementation without the partnerships of advocacy organizations, clinicians, researchers, basic scientists, and industry. And it's wonderful to see a group like this come together to really impact child health, particularly for children with rare diseases. My own experience, I'm a pediatric nephrologist by training and a clinical investigator, so I certainly know that the only way to move the needle to take care of rare diseases is to really work across institutions and work with patients and families in order to really impact child health. So with that, I'll stop and hope you have a wonderful day. It looks like a terrific agenda, and welcome again to Philadelphia.
Thank you so much, Dr. Furth. I am so happy also to welcome you here, and I'm just going to make sure, perfect. So, as you know, this is actually the 9th year of GLIA. We first met in 2013, and many of you who are in this room were actually at that very first meeting, and it's quite amazing to me how much we've grown. We've also grown just in the couple years since we were last together. And obviously, since we were last together, we've had a major pandemic and not been able to be together in person, and it's so wonderful to be together again. I do want to honor those people who might be joining us remotely, because there are a number of people who are registered but not here in person, and we understand that everybody faces sort of different circumstances as we sort of navigate our way out of this pandemic. We're also providing everyone with masks, and we have lots of masks. I know people all have different comfort situations at this point, but we ask that that if possible, people and you're comfortable, to please continue wearing masks when you're not eating or speaking, to allow those people who might have vulnerable family members to feel included and participatory. So in 2019, right, we worked together to form a heat map of where we were in the leukodystrophies at the time. And I'd like to just highlight for everybody that at the time of the meeting in 2019, which was just really a few years ago, although it seems forever ago because of the COVID-19 pandemic, we only felt like there were 10 disorders that we could really discuss meaningfully as far as clinical trial readiness. And about half of them, right, had really no significant therapeutic progress to date, and we were facing significant barriers across a number of different avenues. We chose to, in preparation for this meeting, to redo that same exercise. And the reason why we did that is because we realized after 2019 that those identified gaps and challenges have been our guiding principle for GLIA in the years since that time, and we thought it would be good to have an update, an understanding of where we stood now, and the work that still remained. So I just want to encourage everybody to reflect a little bit on how much progress we've made in the interim. Since that time, we now have benefited from funding in the United States for a consortium that's funded by the NIH called GLIA-CTN. GLIA-CTN is part of GLIA, but not GLIA exclusive in the sense that GLIA is much bigger than GLIA-CTN itself. We have 18 other U.S. clinical collaborating centers that are here and registered as part of this conference, which I think is fantastic. And I hope over time we'll be able to grow sort of our cross-funding strategies across the United States. But we also have 30-plus international partners, and we value those partnerships as well, even though GLIA-CTN funding from the NIH might not be able to extend to that. We're finding ways to work closely and to overcome barriers around data sharing and data strategies for different locations. There are also 9 formal natural history studies that are part of GLIA and GLIA-CTN. We study 30-plus disorders, and we have more than 2,500 participants now enrolled in our studies. They're not all from our work, obviously, but just to sort of be happy about in the leukodystrophy field, there are now 8 disorders in clinical trials. We have 2 approved therapies, none of which were approved in 2019. We have 2 repurposing strategies that are now broadly in use, and over 15 industry engaged partners are here and helping support these efforts in a collaborative way such that we can work together to move therapeutic ideas to treatments. We have 50-plus advocacy partners, and the advocacy partners met yesterday in a specific day to sort of strategize on how to work more broadly together. We have an advocacy committee for GLIA-CTN that represents that shared work, and numerous interactions of those advocacy partners with regulatory bodies, industry members, and scientists. While we're talking about the advocacy groups, I just want to tell you one thing. We want to make sure our advocates get to meet all of you, and so we're launching a pin challenge. Each advocacy partner that's here today has received a series of pins. I'm just going to show one, right? They're this size, intentionally so that you can wear them proudly. The advocacy partners have been told not to give them to you unless you listen to them about what their mission is. Right? And the people who come to me tomorrow at lunchtime with the greatest number of pins from the advocacy partners will win a prize from me. Right? I'm going to give 2 prizes, so we'll be democratic about it. And just really listen to them because they're the driving force of the work we do. We all know they're the reason why we do what we do, and understanding what they need and how we can best interact with them is an important part of the GLIA community. I also want to just endorse the fact that we now have a new generation and that GLIA and the NIH funding has allowed us to provide sort of career development awards to a number of people. And a lot of those development awards have been determined by the need that was set up by the work we all did together in 2019. And so this sort of tells you how important and how longitudinal these meetings are. Once we identify the challenges and the needs, we can translate that into novel careers and novel approaches. So the first one is Eric Malik at Cornell Wheel Medicine, who sort of took some of the work done by the ALD community and the need post-newborn screening to identify newborn screening follow-up techniques. And he has graduated from this to a K Award, so congratulations to Dr. Malik. We now have 2 new awards. Jennifer Orthman-Murphy from nearby at the University of Pennsylvania is working on a relatively recently identified adult leukodystrophy CSF1R-related leukoencephalopathy and the necessary biomarkers. And Isha Srivastava at Stanford, who's looking at additional biomarkers in ALD. Amina Fine, who's one of our work group leaders, is a rising young investigator who also has received an award from GLIA-CTN and is working on translating some of the wearable techniques, which are also in use for AMN in the GLIA-CTN grant, into new leukodystrophies, including LBSL. And then Dr. Eichler has also launched a neurogenetics and gene therapy fellowship at Mass General that also has a trainee, Dr. Amanda Nagy, who is working to become the next generation of clinical trial leaders in this field. And then finally, we attend to even our youngest collaborators. We have here a class of what we call P-Cube students. It's a preparatory program, a pre-graduate preparatory program for students who have finished an undergraduate degree and are preparing for a graduate degree, we hope, in translational science in rare diseases. And they are here today as their first sort of kickoff meeting. If you see them, please welcome them. They are your future colleagues, and we hope to retain them in the field. So back to our heat map strategy, right? Where are we now in clinical trial readiness? The GLIA disease-specific work group, 18 of them in total, so an escalation in the number of diseases, have all met, and they were charged to identify current successes and challenges in their leukodystrophies. They each met with their work group leaders. We had a total of 155 participants, and each filled out surveys before their meetings and after their meetings about where they felt, as key opinion leaders based on a Likert scale, their disease was at this time. And the first thing that's different from last year, apart from the fact that we have, or 2.5 years ago, apart from the fact that we have more diseases, is that we actually now had to separate the survey out into two. One was clinical trials and clinical trial readiness. Another was the clinical implementation of that work. So this first one is a clinical trials landscape, and you'll see that we have meaningful therapeutic strategies at this point in over half the disorders, with also great progress made in advocacy, clinical trial planning and outcomes development, and scientific development with understanding of methodologies of disease sufficient to consider them targetable or druggable. There are things that we now engage in uniformly across all these disorders. Even some of our most new candidates like CSF1R or ALSP now have active and engaged patient community activities, and these are driving forces within our field. But there are other things, like clinical trials, where we still have gaps, and there are active clinical trials, like I said, in about half of the disorders. In some cases, they're pending and imminent, and we hope to see this turn to more green and blue before the next conferences. When we think about clinical management of these disorders, we still have more ways to go. And that's because as we, the step from translating things into research, then into actual clinical care on a day-to-day basis, both in access across the phenotypic spectrum, so that patients who might not be eligible for clinical trials still might have an eligible treatment, access to diagnosis, even in our most far-flung populations, a better understanding of the disease spectrum so that we fully understand what treatments can be efficacious for what patients when, an understanding of symptomatic care while we wait for therapies in some patients, and then obviously, the clinical implementation of disease-modifying treatments still has a long way to go. And again, symptomatic patients and current therapies, this was a key issue that was raised across the disorders, that even when there is a approved therapy, if somebody's already symptomatic, they might not yet have an available therapy. And approved therapies also still is a large gap. So it's essential as a community that we identify gaps in order that we can continue to partner with our advocacy groups and our science partners and our industry partners to understand where our opportunities and challenges are, and so that we can also use this as an opportunity to scaffold across different disorders so that we can use lessons learned from other conditions in order to help along conditions that might be a little bit earlier in their journey, and also so that we can help our funders and regulatory bodies perceive our challenges and ongoing opportunities and work with them in partnership to deliver important therapies to this field. As we have before, the GLIA team will use its output from the conference to establish a series of pilot awards that are likely to be expected in 2023, as well as RFAs for future career development awards. We also hope to solicit new projects for the next series of RDCRN submissions that we expect to do in 2025, and also so that we can make critical investments in data infrastructure and data entry to facilitate new interactions where it's needed, and set up data that needs to be shared. We also hope that others will use the ideas generated here to harness new strategies for leukodystrophies independent of GLIA and hopefully bring them back to this community. So I would like to welcome our work group leaders and our speakers and all the amazing work they've done in advance of this meeting. It's a little bit of an atypical meeting setup in that you're seeing the product of a series of interactions that have happened before the meeting. So the talks are going to be short, right, with the goal of really giving us not so much a review of what we might already know, but actually only a setup and an information for what we need to think about, what we need to know next, right? Each work group leader is going to be asked to bring their speakers down, and everybody's going to speak here to facilitate transitions. Each work group's talk will be limited to 35 to 40 minutes, and we will enforce that, although I know we're starting late. We'll just consider ourselves jet lagged by 30 minutes and then try to keep to time, and then try to keep 5 to 10 minutes for questions. If we don't get to your question or we remind you of the time, please don't take it personally. We want to make sure that every single condition and disorder gets a full allotment of time. And so we're going to keep a tight schedule. And otherwise, I welcome you. I hope that we harness your thoughts and your engagement, and most importantly, your plans for the future for the leukodystrophy field. Thank you very much.